everyone, so I'm back with you again, and just like I stated before, we're going to be talking about the myths concerning IUCDs or intrauterine contraceptive devices. So don't go anywhere, guys. I'm going to get right into the video. So, it is important to talk about the myths concerning IUCDs or intrauterine contraceptive devices because a lot of people have made decisions when it comes to what method they should be taking for their family planning because of things that they have heard. It is important that when you take your method, you make informed decisions and not just things that you hear, but you make sure that whatever you hear, you do your own research, talk to your care provider because they are also going to help you to actually choose the best method that is right for you. So we're going to talk about the first thing, and that is your IUCD and if it actually causes infertility. Now, the short answer is no, your IUCD does not cause infertility. Your IUCD can either be hormonal or non-hormonal, as we have identified in our previous video, right? Your non-hormonal IUCD is the copper T or the copper T380A, or your devices that contains copper. Now, copper is very safe to use once you're not allergic to copper. And if you are allergic to copper, you would already know because copper is in a lot of things that we use on a daily basis, right? So the way it is inserted, we make sure that we have to measure the length of your uterus. We have to ensure that we gauge our applicator properly so that we get the length properly before we insert it. And then there's a technique that we do to ensure that it's not going any further than it needs to go when we are inserting it, right? So your IUCD, whether it's the hormonal or which is the Mirena, or the non-hormonal, which is your copper T, none of them causes infertility. The hormonal IUCD, which is Mirena, actually has a hormone in it that helps to prevent you from getting pregnant, other than just the shape of the method, which is also very effective in helping to prevent you from getting pregnant. When you stop using your hormonal IUCD, your hormones get back to normal, and then in no time you'll be able to start conceiving again. For the non-hormonal copper IUCD, that you can get pregnant immediately after taking it out once you're ovulating. Now, if you have infertility for any reason whatsoever, it is not, more than likely, not related to your IUCD, and it may be something that has to do with your hormone or some other factor. But this is what you need to discuss with your practitioner, your OBGYN, or your midwife if you are concerned about infertility issues. But I can state that your IUCD, once inserted correctly, does not cause infertility. All right, so let's jump to the next point. Another thing that some persons say is that it causes ectopic pregnancy. It actually does not cause ectopic pregnancy. It actually reduces your chances of getting ectopic pregnancy. So if you remember the previous video, and I'd ask you to jump over and look at it. Just a second, if you'd like to. But the way the copper T is shaped, it actually helps to prevent the sperm and egg from meeting. Your sperm and your egg normally meets at near the entrance of your tubes, right? So it meets there, and then it takes its time to go down into your uterus where it is implanted, right? So it prevents the sperm and the egg from meeting because it actually uses the extension of the teeth of the copper T to actually, or your Mirena, to actually prevent the sperm and the egg from meeting at that point. So if it is preventing the sperm and the egg from meeting, then the chance of you getting pregnant is very, very slim, and the chance of you getting ectopic pregnancy will actually also be very slim. It also makes inside of your uterus unfavorable for a pregnancy. But if your copper T fails and you do get pregnant, your pregnancy will still be inside your uterus and it will be there with your copper T unless it's removed, right? So, and then there is no risk for any effects to the baby or so. Some persons say that you may have premature delivery, but in most of the cases where persons that I have seen who have gotten pregnant with their IUCD inside, they had a full-term normal pregnancy. And a lot of the times the reason why they got pregnant is because the copper T actually came out. And just like every other method, as we stated, none of the method is 100% safe from pregnancy. And even though it says over 99% safe from pregnancy, there's still a slight chance that you can get pregnant on your method. All right. So other states that it only prevents pregnancy by preventing implantation. No, it prevents pregnancy by preventing the egg and the sperm from meeting. It makes inside of your uterus unfavorable for a pregnancy. It literally slows down the sperm. The egg only lasts for 24 hours. So if your egg only lasts for 24 hours, most likely it is going to be absorbed before the sperm gets to it. Now, if on a normal day, a healthy sperm takes 6 hours to get to the egg, can you imagine if it is slowed down exponentially and it is also playing tug of war with other sperms and it's going through all the acids that is in the vagina and it's going through all of those buildup of discharge that is there to help to slow it down even further. By the time it gets to the egg is already dissolved. All right, and then most of the times, by the time you had intercourse, you'd have probably ovulated already. And even if you did not ovulate, it's not going to get there in time. So as I stated before, the tip of which is the base of your copper T or your Mirena, helps to prevent the sperm from getting inside of your uterus. Now, if it gets inside your uterus, the copper, which is around the body of your IUCD, helps to slow down the sperm. Also, the hormone that is in your Mirena helps to slow down the sperm. By the time it gets to the tubes to get to the egg, there's more copper up there to slow it down even further than the tip of the T's actually helps to prevent the sperm from going there again. And if you have the Mirena actually helps to prevent your ovaries from releasing an egg. So there will not be any egg waiting. And if there's egg waiting, because of the shape of the Mirena, it actually has a very warm and difficult time to get to your egg. So they are very effective in preventing pregnancy, and it actually has 3 method of actions that actually help to prevent pregnancy. All right, or mode of action, sorry. One of the myths that I've heard is that your IUCD actually causes sexually transmitted infections. Sexually transmitted infections is, as it states, sexually transmitted infections. That means you can only get it by sexual intercourse. So your copper T is sterile. It is inserted in the uterus, sterile. So if you can only get your sexually transmitted infections from having intercourse, there's no way your copper T or your Mirena IUCD can cause you to get a sexually transmitted infection. It is what it is, a sexually transmitted infection. So you can only get it sexually. All right? So there's another thing that they says it gives cancer. Now your IUCD does not cause cancer. It is not carcinogenic, which means it causes cancer. It does not have any cancer-causing mechanism or hormones inside of it. All right? But it is important to note that if you do have cancer, we do not put it in, because hormones and cancer does not go well together. And that is why if you've had cancer, you are encouraged not to get pregnant, because there are hormones that are associated with pregnancy that can cause worsening of your cancer or make it harder for you to treat. And while you're pregnant, they do not want to treat you for cancer because the cancer medications can affect your baby. If you have any form of cancer, we do not put any IUCD or any family planning method in unless it is a barrier method like your condom. All right? It does not cause cancer and it does not cause sexually transmitted infections. There's another thing or another saying that it causes deformity in the baby or abnormality or birth defects. None of them causes birth defects. Now, the Mirena, which is the one that has the hormone in it, has the same hormone, progesterone, but it's synthetic. So it's the synthetic version of your progesterone, right? And your progesterone is normally dominant in your pregnancy and for most of your pregnancy, and that's to maintain your pregnancy so that you do not have a miscarriage, right? Or you do not have a premature baby, right? It has the same hormone. So it does not cause any deformity, any birth defect in your baby, because the hormone that is inside of it is very safe. If you are pregnant, we do not give it to you because there is no reason to be giving you any hormonal medication to prevent pregnancy when you're actually pregnant. All right? It's like being counterproductive. The copper T with the copper also does not cause any birth defect in your baby. How these methods are, they do not cause birth defects. So if your baby has a birth defect, it can be because of congenital, it can be chemical where it has to do with some shortage of some nutrients or so, or from a teratogenic agent such as a pill that was taken, or just familial relations where it has to do with your genetics, right? So these methods does not cause any form of birth defects. A lot of persons have taken or have had these methods in situ or inside while they're pregnant and have had very healthy babies. This is something that I've heard a lot of people talk about. Their IUCD cannot be found, so therefore it traveled somewhere. No, your IUCD cannot travel to any other part of the body. So if you remember what your uterus looks like, you can go to the previous video where we talk about what is an IUCD, right? And when you look at that video, you can see how your uterus is shaped and how your copper T looks when it's inside. And if you notice, and we can look at what a T looks like, a capital T, like this, and this is the top of your uterus. It's very thick, right? And the T is just there, bracing on the top, like that. There's no way that this part can go through your uterus, right? So it stays there. and your uterus is open only through the tubes, and your tubes are very, very fine. You cannot even notice the opening of your uterus on an ultrasound unless a dye is inserted inside of your uterus. And most of the time they do an x-ray with the insertion of a dye to see how patent your tubes are. So your copper T or your Mirena, looking like a matchstick, cannot go through those once it is placed inside properly. It stays there. If it's ever going to move anywhere, it's going to be coming out because your cervix, which is the neck of your womb, is more open, especially if you've had a baby before. Your cervix is a little bit wider, and so it can come out. And so that's why there are persons who can and who cannot take the IUCD as their method of choice. But your IUCD does not travel anywhere other than stays put inside your uterus until it is ready to come out. So if you've had your IUCD in and you cannot feel your string, it's either your string is loosened, your string is up inside your cervix because it just folds up a little, or your IUCD came out. But what your midwife will do, or your OBGYN, is to actually ask you to get an x-ray done or to get an ultrasound done to ensure that it's in place, or to see if it actually came out. If it came out, then we'll reinsert it if it is what you desire. If you do not wish for it to be reinserted, then we help you choose another method. If the copper T is inside and it's there, and we cannot locate your string, we opt to remove it, and then when we remove it, we reinsert it if that is what you desire. If you do not desire to have it reinserted, then we also help you to change your method to one that you desire if you so wish to continue to prevent pregnancy. Alright, so your copper T, in a nutshell, stays put once it is inserted properly, and it will not travel to any other part of your body. Okay, that would have been a painful migration, and my dear, that won't be happening anytime. All right, so you can rest assured. Some women are concerned that because of where the IUCD is, it can cause pain during intercourse. No, it does not do that. Your IUCD is comfortable and snug inside of your uterus, and so therefore you nor your partner should be feeling your IUCD during intercourse. So by saying that too, gentlemen are also concerned that they may be feeling the IUCD when they are having intercourse with their partner. But no, your IUCD or the IUCD is way inside your uterus, and it is between a cushion, soft, nice cushiony layer of the cervix and where it's inside of your uterus, right? Now, if your partner actually feels the IUCD, it's probably because the string was cut too long or the string was cut too short. But how we cut the string, we cut it so that you're the only one that can feel it, and we actually teach you what to feel. So your partner is not gonna just go and feel it. And also, if it is coming out, your partner may be able to feel it. And if that is happening, you go right back to your OBGYN or your midwife to have it assessed. Assessing it, then we'll be able to see if it's actually coming out. So if it is coming out, we'll remove it and replace it if that's what you wish. Sometimes your partner may think that they're feeling it, and if you tell them that you remove it, they stop feeling it. So sometimes you can just do that and see if they stop feeling it. So if they stop feeling it, you know that it's fine. Don't worry yourself. You can still go back to your care provider and make sure that you assess the problem. All right? So it will not be displaced either because of where it is. It is inside the uterus, and that's where it's going to stay. the most likelihood for it to come out is when you're having a period, right? Either it's going to come out because the cervix is too wide, and that happens sometimes during labor where the cervix went through a lot of trauma, and so it never goes back really too close to what it was before. So some ladies have a really wide cervix, and then just by assessing, sometimes we look at it and realize that you won't be able to keep an IUCD in, so we'll encourage you to try something else. All right, so these are some of the myths. If you have heard any myths that you want to dispel or you want to know about, be free. Don't worry. Remember that I don't bite. You can always shout off in the comments and send me your questions, and I'll be more than happy to assist you in clearing up any misconceptions that you've had when it is pertained to your IUCD, whether it's your Mirena or your Copy, because we're here to help you to make informed and wise decision as it pertains to your family and how you decide to plan it. All right, so please do not go without subscribing. Do not go without liking. Share with your friends and family, because information can never be too much. I'm your girl Taylor. Have a wonderful day. See you next time.